President Preckwinkle, welcome.
Welcome. Thank you very much, Kelly, for the kind introduction.
Well, we're so pleased for you to be able to join us today. I know you have been at numerous CCAC meetings over the years and provided remarks, and we can't think of a more interesting time to be able to hear from you and what's happening in the county. I am quite sure that our members know who you are, but just as a very quick overview, President Preckwinkle is the 35th president of the Cook County Board. She was elected in 2010. It's hard to believe it's been 10 years already, President. And I know you and I met before you were even sworn into office, so it's a long-standing friendship. Leveraging more than 30 years of political experience and leadership, President Preckwinkle has restored credibility to county government. She is a nationally recognized leader to drive and reduce unnecessary and costly incarceration of nonviolent offenders in the criminal justice system. And the MacArthur Foundation awarded Cook County one of its highly competitive safety and justice grants in recognition of the county's progress in criminal justice reform. I know, President, that you have also successfully fought for juvenile justice reform, and you serve as the president of the Forest Preserves for Cook County. So thank you again for joining us. Thank you for your amazing leadership. And we're really looking forward to hearing from you today.
Thank you very much, Kelly, and good afternoon to everybody. I'm pleased to be with you today to provide an update on Cook County's priorities and our response in this challenging time. We've been preparing for the potential spread of COVID-19 since last December, when we first learned of the coronavirus in Wuhan, China. In January, the Department of Emergency Management and Regional Security and the Cook County Department of Public Health worked to ensure that resources were in place to assist suburban municipalities and especially suburban first responders. I hope that our viewers understand that the county's allocation of federal resources go entirely to the suburbs, and the city of Chicago gets its own allocation. So as we've been distributing CARES Act resources, they have gone to suburban communities. In February, we began preparing for a worst-case scenario. We wanted to ensure that if necessary, our county workforce could work primarily from home and still carry out essential services. In March, I issued a disaster proclamation so that we could access emergency funding from the Federal Emergency Management Administration and work quickly to procure emergency services and supplies. Most of the workforce in my administration began to work at home and practice physical distancing. To date, Emergency Management and Regional Security has donated more than 2 million pieces of personal protective equipment throughout Cook County. Emergency Management has coordinated alternative housing for COVID-positive residents, first responders, and other essential workers. Emergency Management has also coordinated with hospitals throughout the county and the Medical Examiner's Office to assist with any resource needs. The Cook County Department of Public Health has worked diligently since the first positive case in Cook County in January to conduct contact tracing, answer resident questions through a multilingual hotline and email, continuously update community organizations throughout the county on weekly calls, and coordinate with city and state officials on our efforts. During the spring months, we also faced considerable challenges in our criminal justice system. At the time, the Centers for Disease Control described the situation as one of the largest outbreaks in a congregate setting in the country. That's our Cook County Jail. We acted quickly to depopulate the county jail and the Juvenile Temporary Detention Center to contain the COVID-19 outbreak. I want to commend Sheriff Dart for his good work in collaboration with our team. These proactive steps proved to be significant. The CDC lauded our aggressive mitigation efforts in a recent study, and the situation at the jail has improved to the point where we can now allow visitors again. We're all navigating an unimaginably difficult period in our history. While I'm encouraged by the progress made in slowing the spread of COVID-19, we marked a very solemn milestone 2 weeks ago. The Cook County Medical Examiner's Office surpassed 10,000 deaths in 2020. To put this in perspective, the office handled 6,274 deaths in all of 2019, and there's still a quarter of 2020 to go. Now let's talk about equity. I've made racial equity a priority in my administration. In 2018, my office published a 5-year strategic plan, our policy roadmap, to guide our work. We looked for ways for government to advance equity through policy and practice. This roadmap has been the center of our recovery efforts. In May, my office released the Cook County COVID-19 response plan, from rapid response to equitable recovery. This plan follows Cook County's initial response to the crisis and outlines priorities for the next several months. In a continuation of the county's commitment to advancing racial equity, the plan is focused on addressing inequities that have been exacerbated during the pandemic. We're seeing firsthand during the COVID-19 pandemic how glaring the inequities are. We know that in normal times, our Black and Brown communities struggle with disinvestment, access to healthcare, food insecurity, lack of economic opportunity, language barriers, and other forms of inequity. These inequities are only exacerbated during the public health crisis. In June, our strategy shifted from response to recovery. This is not work that will happen overnight. We'll feel the impacts of COVID-19, I'm afraid, for years to come, and I stress that the pandemic is far from over. One area we know needed immediate support was small businesses. As businesses began to reopen their doors, we heard from many that it would be a struggle to stay afloat. To respond to these needs, the Cook County Bureau of Economic Development launched the Community Recovery Initiative, a rapid response program to provide equitable and holistic, comprehensive financial relief and critical support services to help suburban Cook County residents and small businesses rebound stronger than ever from the impact of the COVID-19 pandemic. The initiative, funded by the Federal Coronavirus Relief and Economic Securities Act, is part of our ongoing commitment to promote equitable economic growth and community development. Some of the programs under the initiative include rental assistance, a program to help suburban Cook County residents having difficulty paying their rent as a result of the COVID-19 pandemic. This program was launched in partnership with the Housing Authority of Cook County, HAC. A community recovery loan fund, $10 million fund that offers zero interest loans of $20,000 for small businesses and $10,000 for independent gig workers. The Paycheck Protection Program, which helped 179 businesses access more than $3 million from the Paycheck Protection Program. While we know these programs cannot fully address the tremendous need in our communities, we hope that these programs will help residents in suburban Cook County to recover. Another critical piece of our recovery efforts is the distribution of CARES Act dollars to municipalities in Cook County. We received $429 million in funding from the Coronavirus Aid and Relief and Economic Securities Act, the CARES Act. About $51 million of this funding will be distributed to our suburban municipalities for eligible costs. Under the CARES Act, units of local government with a population of more than 500,000, such as Cook County, are eligible to receive this funding and have the ability to distribute these funds to municipalities under this threshold. My office and our finance team put together a comprehensive and equitable process to distribute CARES Act money to the municipalities. So far, we have awarded more than $1 million and will continue to help municipalities receive this funding before the September 30th deadline. The COVID-19 pandemic has resulted in a new set of challenges during our recovery period. We're in a dire economic time, as well as a national moment of reckoning with racial injustice and civil unrest. All of that said, I'm hopeful for what's to come. Our people have never failed to meet the challenges that face us head on and come back stronger. I know we'll get through this as one Cook County. Now I look forward to any questions that you might have. Kelly?
Just trying to get my video back. There
we go.
All right. Well, thank you. And as a reminder to our members, please use the Q&A button to submit questions, and I will be happy to relay them to President Preckwinkle. So first and foremost, President Preckwinkle, how are you and your family? I mean, this has been such a difficult time.
Well, I'm very grateful to be in good health. My daughter is a nurse and on the front lines in this pandemic, and I worry about her every day, but she is well. And it's been a real challenge because, as I said at the beginning of the pandemic, all of us are going to know people who will be ill with the disease, and all of us will know people who have succumbed. And that's true for me as well as everyone else.
Yes. And You're familiar with our membership, which is comprised of architectural firms and design firms and real estate lawyers and higher ed and developers, people that are really committed to making a difference. Is there anything that, any message that you would like to give our membership in terms of how we might be able to support your administration or what you would like for us to be doing during these times?
Well, first of all, let me just say, Cook County government, most of our resources go, as I said, to suburbs because the city of Chicago gets a separate allocation, whether it's for affordable housing, community development, block grant resources, resources from the CARES Act to deal with the pandemic. So our focus is the 134 cities, towns, and villages outside of Chicago. But this is a particularly difficult time for the city of Chicago. And whatever support your members can give to our city is much appreciated. I mean, one of the things that I think people need to do is begin to think of, sort of what comes after the pandemic. We've talked about rapid response and equitable recovery. That's our plan. That's our motto. And I think your members and their firms need to be thinking in that same way. I mean, we have to understand that the pandemic is far from over. Over the weekend, there were stories about dramatic increases in cases in France and Spain and the United Kingdom. And of course, we continue here in the United States to bear the brunt of the first wave of the pandemic. And it's anticipated that there will be a second wave and maybe more. So we have to figure out how we're going to not only deal with the pandemic, but the economic crisis that has resulted. And at the same time, simultaneously, a real focus, and this is cyclical in this country, a real focus on racial injustice that has been prompted, of course, by the murder of George Floyd. But we live in a country in which, I always say, Black and brown people can be murdered with impunity by the police. And the extent to which our members can focus on helping their employees deal with the pandemic, deal with the economic crisis, I would hope that they would add to that an effort to address both within their corporations and their communities the whole question of racial inequity, which has dogged this country from its inception.
Yes, and President Preckwinkle, we've had some programming in regard to the social equity issues. And in November, as you're aware, the Alliance for Regional Development, our sister organization, teams up with the Federal Reserve Bank of Chicago. And this year, we're going to have a panel with the 3 presidents of the urban leagues from Chicago, Milwaukee, and Northwest Indiana. So it is a conversation that CCAC is committed to continuing in order to help people understand what they can do. And we've had Kim Dowdell, who is an active member with CCAC and the president of the National Organization of Minority Architects. She's participated in 2 panel discussions that we've had. And she has noted some real action steps for our members in terms of mentoring, bringing people onto boards, and some really proactive efforts that we think can really make a difference. So I want you to know that that is, a top priority for our group.
Good, I'm glad to hear it.
That we have some questions coming in. So the first I'm going to read it is, please share your thoughts regarding the next stage of stimulus referred to as the HEROES Act.
I wish I were more optimistic. As our viewers are probably aware, the House passed in May a $3 trillion HEROES Act and sent it to the Senate. And the Senate has yet to act on that House measure. And it's unclear whether they will before the election. And that's profoundly troubling because local units of government were surely helped by the CARES Act. It reimbursed us for many of our coronavirus related expenses. However, the other big challenge that governments at all levels face is lost revenue. And the HEROES Act attempted to address that for state governments, for county governments, for city governments. And unfortunately, because the Senate has not acted, there has been no support from the federal government around lost revenue to local units of government. And that's a real challenge. We find ourselves in the county facing a $300 million shortfall in this fiscal year, which ends November 30th, and a $400 million shortfall projected for the 2021 budget, again projected. And that's $700 million in the next several months. We have to figure out where we're going to find. And that's, it's not quite as daunting as the city's $1.2 billion challenge, but it is considerable for us.
Absolutely. The next question reads, could you please speak to the COVID impacts on the county's capital planning, procurement, and upcoming budgets?
Well, I think I responded a little bit in the previous question. The budgetary shortfall for this year is $300 million, and it's mostly lost sales tax revenue as the economy has ground to a halt. The projected gap for next year is $400 million, so that's a tremendous challenge. And you know, in a time when you're in a recession that borders on depression, making cuts in staff, which means more people are out of work, a draconian measure will be on the table, but it surely is something that none of us want to do. Because it just means that more people are out of work and unemployed, and you know, and in desperate shapes in a difficult economy. So we all face as executives in this difficult time tremendous challenges around, first of all, dealing with the pandemic, and then, as I said, trying to address the economic collapse that's ensued.
So I think maybe the member was getting more towards, were there any upcoming projects or capital planning that maybe you've had to hit the pause button on?
Well, as you know, capital budgets are different from operating budgets. And so we have bond funding that is available to us to do some of our capital projects. And the question is whether we'll go in the bond market to pursue others. We will continue our planning, for example, for Provident Hospital. We have a facility on the south side of 51st and King Drive, but it's inadequate to our present needs. And what we need is a regional outpatient center and some hospital beds. It's unclear how many. And we're going to try to get that done by, I think the latest projection is 2023 or 2024. So we're in the design and planning stages now for that facility. But we're going to continue to make that tremendous investment. And we're going to be building an ambulatory care facility, an outpatient clinic, I think up in Belmont Cragen. So we will continue with our big capital projects. And actually, this is a good time for government to be in the bond market because interest rates are very, very low.
Absolutely, that's great. The next question reads, are there any Cook County programs in place or in development that might offer some form of relief to suburbs suffering from lost tax revenues? I think you may have addressed that. Maybe you can repeat yourself.
Yeah, Secretary Mnuchin, Treasury Secretary Mnuchin has made it quite clear that the CARES Act money, which is available to us, cannot be used for lost revenue. So unless and until the Senate and the House agree on a coronavirus aid package, whether they call it the HEROES Act or something else, unless and until they agree, there is no support for lost revenue. Now they may change the rules and say we can use some of our CARES Act money for lost revenue. That would be fine. But they have not done that, nor have they passed this subsequent legislation called the HEROES Act. So at the moment, there is no reimbursement for lost revenue, either for the county or for the suburbs with which we share our resources.
I think we really need to make sure that we're contacting our representatives in Washington and letting them understand how dire the situation is.
Right, and anybody who has any friends in the Republican Party, particularly folks who can get in touch with Republican senators, it would be very helpful to share with them how important it is to local governments, whether they're led by Democrats or Republicans. It doesn't matter. We all share the same challenges around lost revenue.
Right. Thank you. The next question reads, has there been any discussion about the county obtaining Mercy Hospital?
We have a public health system, a $6.2 billion budget, 2.8 billion of it goes to healthcare. Almost half of our budget is healthcare. And we are struggling financially in the midst of this pandemic to keep our healthcare system afloat. And we cannot afford to assume the responsibility and obligation of operating any other facilities like Mercy. I don't know where the state is on this subject, but the county does not have the resources to do this.
Another question reads, when does the county expect to announce the new health system CEO, and how will that person get integrated into the county's current and ongoing COVID response?
Well, our board of our health and hospital system, we have an independent governing board, has been in the process of attempting to choose a new CEO. I'm very grateful to Deborah Carey, our interim CEO, for her fine leadership. The challenge, of course, is that the candidates are around the country, some of them in places that have been put on the city of Chicago's quarantine list, which means they haven't been able to come here. And I think it's really important that the board be able to interview the candidates personally, and that the candidates see our health and hospital system and our operations. So it's unclear when that will be able to take place, and therefore when we would have a list of final candidates that we might be able to interview.
Thank you. And again, I remind the audience to please use the Q&A button, and I will be happy to relay your questions. So the next one reads, would the county be interested in Mercy if a funding package from the state or other sources came to the table?
I don't believe so, because there's no guarantee that the funding package would remain in place. The problem is, taking on this responsibility without a guaranteed income stream to support it would be extraordinarily difficult. And, we have our own plans for Providence Hospital, which isn't that far away. Mercy is, at McCormick Place and King Drive, and which is what, 27th Street, 28th Street, something like that. And Providence is at 51st and King. So they're in the same neighborhood, more or less. And Providence has been a county facility since the early 90s. So I think it's extraordinarily unlikely. If the state is interested in operating Mercy, the state should pursue that.
Thank you. The next question reads, in the rapid response recovery plan you outlined for the county, could you elaborate on whether it is being handled internally by the county, or if you are engaging outside vendors, subject matter experts, for example, especially on the healthcare side?
Now, we've engaged subject matter experts in dealing with the federal government around emergency relief. There are experts who help local units of government ensure that they're meeting FEMA guidelines, the Federal Emergency Relief Administration, right? And we have hired a firm to help us be sure that we're meeting all the parameters of the CARES Act. The problem is, if you're a local unit of government and you don't spend the money appropriately, you got to give it back. So we've hired a vendor to work with us to be sure that we're following all the federal guidelines, and likewise that the submissions for reimbursement from the cities, towns, and villages also meet those guidelines.
President Preckwinkle, you noted in your opening remarks that there were certain loan funds available for small businesses. Is there money still in those pots?
No, not at the moment. Although, depending on how well utilized our support for municipalities is, there may be some extra money to devote to small businesses and gig workers. I would encourage anyone who's on the call and involved in suburban government in any way, to encourage those suburban units of government to apply for the dollars that are available to them. We have, I think, 134 municipalities, and so far we've heard from about 41. And the deadline for application is September 30th, so there's not a lot of time left. Basically, 3 weeks. So we really need our suburban, and we had a press conference this morning in Oak Lawn and one last week with the mayor of Schaumburg to talk about this. Both of them had responded quickly to our offer of support and have already gotten their checks. So I'm encouraging leaders in all of our cities, towns, and villages to apply for the county support that's available to them.
President Preckwinkle, when you are, out and about, as you mentioned, being in Oak Lawn as an example this morning, or anywhere for that matter, what are you seeing in terms of people wearing masks?
At all our press conferences, everybody wears a mask.
Much
Well, it's uneven. Um, when I was out in the spring in the forest preserves, and we kept our forest preserves basically open, sometimes I would see people with masks, more often not. Um, I was up in Arlington Heights this weekend for a farmer's market and a visit to their historical site there, and almost everybody was wearing a mask. And depending on where I go, the folks in the community are either more or less observant of the mask requirement. But we can do a lot to mitigate the spread of the pandemic. The pandemic is here; it's not going away, unless until we have a vaccine, and that will be considerable months from now. So we can do what we can by masking up, by washing our hands, by maintaining physical distancing. I like to call it physical distancing rather than social distancing, because social distancing implies that you're disconnecting with people. And what we want is people just to practice physical distancing and stay connected. So those are things we can all do to mitigate the pandemic. And, more than 180,000 Americans have lost their lives in this pandemic. And we owe it to ourselves and our family and our communities to do everything we can to, as I said, mitigate the spread. And we're entering a period where, there's an annual flu season, basically from fall to spring. And that flu season coincides with what our epidemiologists expect will be a second wave of the pandemic. So we've got several reasons for observing, wearing masks, washing our hands frequently, and observing physical distancing.
And for the viewers that may not be aware, Cook County is comprised of 30 townships, if I remember correctly, and the city of Chicago?
Yes, 30 townships and 50 wards.
Okay. So it looks like there's a lot of interest on the Provident Hospital. So we've got another question. You mentioned the hospital redevelopment is under design/planning. Can you advise on the timing for the hospital RFP?
No, I can't. I haven't talked to my staff lately about that. But as I said, we hope to have the new hospital and regional outpatient center, and most of the services in the new facility will be ambulatory care services. We hope to have the new hospital completed by 2023 or 2024. That's what we're working toward.
Excellent. The next question reads, apart from the HEROES Act, assuming for the moment a new administration in Washington, D.C., what initiatives would you encourage a new administration to pursue regarding further healthcare reform, criminal justice reform, and specific steps to address racial injustice and ill effects? And that message, that question comes from our chairman, Greg Hummel, who I would like to be able to get on camera with us, but that's not happening at the moment, so maybe you can dissect the question.
Okay.
Healthcare reform, criminal justice reform, racial injustice.
Yeah, the whole ball of wax. Okay.
What do you want Biden to do?
First of all, we need reimbursement to local units of government for lost revenue, because if we don't have that, local units of government are going to be laying off police officers and firefighters and streets and sanitation staff, right? That's where most of the money goes. Defense, whether it's from fires or crime or disease, right? So most of the budgets of our local units of government go to fire and police and sanitation. So lost revenue is critical. For our residents, we need to continue the supplemental unemployment benefits that kept so many families afloat during these really difficult times, and which ended in July. And it's unclear whether the president can just by executive order reinstate a more modest supplemental $300 instead of $600 supplemental benefit, and whether the states will follow his executive order. So we really need congressional action. Just as we had congressional action early on in the pandemic, we need congressional action to continue these supplemental unemployment benefits. Otherwise, we're going to see a wave of evictions and foreclosures that will dwarf the challenges we faced in the last depression in 2008. All right, so that's the economic side. On the public health side, you know, we have unfortunately in this country disinvested in public health for a very long time. So we need to provide federal resources to bulk up our public health efforts at the local level. You know, this may be the last terrible pandemic I see in my lifetime, but for most of our viewers, that's not the case. I mean, the predictions are partly as a result of climate change and encroachment of human populations on wild populations. There are going to be more viruses that jump from the animal kingdom, other places in the animal kingdom, to human beings. So this is not the last. I mean, the last terrible pandemic we had of this magnitude was 100 years ago, but it won't be another 100 years before we have a similar pandemic. We've got to figure out how we're going to bulk up our public health operations to deal with what will be, if not frequent, at least not unusual pandemics going forward from this point. Okay, so pandemics are part of our future. So we have to figure out how we're going to deal with them. And one of the ways in which we can deal with them is to bulk up our public health capacity. And we need to have capacity in our own country to make personal protective equipment. We shouldn't be dependent on China or India for these things, or the components that make up our medicines. Again, China and India. We need to have internal capacity in the United States to meet a public health crisis, and that means personal protective equipment. It means, you know, the components of our medicines and so on. So we got to have a strategy for dealing with pandemics, and that involves public investment to make that happen. And we need more support for Medicaid. You know, in Cook County, we run at Cook County Health the largest Medicaid expansion program in the county. But we don't have, the reimbursement rates for Medicaid aren't the same as for Medicare. So Medicaid is for people 19 to 64, and Medicare is for people 65 and older. And hospitals and physicians and healthcare providers get more money for taking care of Medicare patients, that is gray-haired people like me, than they do for people who are 19 to 64. And that's a real challenge because the same services are required, right? Just because you're a different age doesn't mean that the services cost a different amount. So we have to have more equity in the Medicare and Medicaid funding, which we don't presently have. So we need to invest more in public health. We need to invest more in Medicaid. Okay, I've said what I think is practical, that is investing more in Medicaid. What we really need in this country is universal health care. Health care ought to be everybody's right. You know, I run a public health system, and half of our patients, I've misspoken. Half of the charity care delivered in Cook County is delivered by our 2 hospitals. And there's 68 hospitals in Cook County. 68, and our 2 hospitals provide 51% of all the charity care. And that's because many of our so-called not-for-profit hospitals don't provide charity care to people. They send their poor patients to us. And that's not tenable in the long term. And the way to deal with it, I think the best way to deal with it is to provide universal health care. Now we can quibble about the characteristics of that, but what we need in this country is universal health care. So first I talked about what's likely to happen, or if God willing, which is that we work on Medicaid expansion and comparable recompense for Medicaid and Medicare patients. But what we really need is universal health care. On the criminal justice side, so we have 5% of the world's population and 25% of the prison population in the world. I'll say that again. We have 5% of the population in the world and 25% of the prison population. So unless you think that Americans are more likely to be criminals than people elsewhere in the world, I don't believe that, then we're doing something really terribly wrong. And disproportionately, the people in our prisons are Black and brown. And it's a result of hyper-policing of Black and brown neighborhoods and disparate sentencing. Black and brown people get stiffer sentences, having the same characteristics than white people. It's a fundamental part of the endemic racism in this country. And it's a tragedy, and it devastates Black and brown communities because so many of our working age young men in particular find themselves in prison for things that white people aren't sent to prison for, or if they are, they get much lower sentences. So let's see, what have I said? I've talked about finances, I've talked about healthcare, talked about criminal justice, Racial justice. Okay, we have to acknowledge that this is a profoundly racist country. I'm going to say it again. We have to acknowledge this is a profoundly racist country. And unless you're willing to acknowledge that and then work to try to address it, we're never going to get anywhere. And pretending, as Trump does, that it isn't a profoundly racist country, and patting white supremacists on the head and encouraging their despicable denigration of immigrants and people of color, it's just appalling. So, in whatever arena you find yourself, you need to speak up on this issue. And we can't leave it to black and brown people. I'm sorry, the majority of people in this country are white, and white people are going to have to address this issue. You know, it's a challenge we all face. And you can't dump it on our doorstep and say, all right, you black and brown people, figure out how you're going to address this. Sorry, that's not the way it's going to work. If we're ever going to be successful in addressing the racial inequity, the incredible racial inequity that we find in this country.
Well, thank you for your very insightful and frank remarks. Of course, that does.
Frank, yes.
It does lead to more questions. So going back to the healthcare front, you were the board president before Obamacare or the Affordable Care Act. What have you seen in terms of what has worked and what hasn't worked from kind of pre-Affordable Care Act to now?
Well, actually, I wasn't. Obama was elected in 2008. He took office in January of 2009. They passed the Affordable Care Act pretty quickly thereafter. And components of it, basically came into effect in the following year, which is when I was elected. Okay. I was blessed to have Dr. Ram Raju as head of our public health system early in my tenure. And he encouraged us to ask for a waiver from the federal government and get started with some of the components of the Affordable Care Act, which were applicable to us, namely Medicaid expansion and creating our own Medicaid expansion program called County Care. I'm deeply indebted to him because it enabled us to get reimbursement for patients we were serving anyway under our charity care, enabled to get federal resources to support them because they could now be eligible for Medicaid. So the Affordable Care Act has made a tremendous difference for our hospital system because many of our patients who did not have insurance, who were uninsured or underinsured, are now eligible for Medicaid, and we get reimbursements for their care, which we didn't previously. Although, as I said, not only do we have a high Medicaid population in our health and hospital system, we have a very high proportion of patients who are uninsured at all.
And from the reading that I've done, my understanding of the Biden-Harris campaign platform is not that they're really talking about universal health care, but I do believe that Vice President Biden is talking about lowering the Medicare age to 60. So, it's baby steps, I guess.
Look, I'm in favor of any incremental change that makes it better for Americans. The long run goal has to be, however, universal health care.
Thank you. So, we've read in articles how the Obama administration had a pandemic team and they had a number of exercises and had a manual, and that the Trump administration kind of disbanded and, found the manual maybe after the fact. So one question I have for you is, are you working with the 30 townships to, really kind of worst case scenario situations moving forward? If in the fall and winter, as Dr. Fauci has said, could be the worst that America has ever seen. If the federal government does not follow through with reimbursing small governments or local governments, and all of a sudden police and fire are being laid off, who are there plans being made to address these worst case scenarios?
The Cook County Department of Public Health is responsible for our public health planning. I have great confidence in Dr. Rachel Rubin and Dr. Kiran Joshi, who are co-leaders of that department. I know they're trying to figure out how we're going to manage, given the fact that we will have this dual difficulty in the winter and the spring, namely the annual flu virus and then the COVID-19 virus. I'm sorry I can't tell you the particulars of their plan, but I'd be happy to have them share them with you and your members subsequently.
Great, thank you. And what about the working with the 30 townships? Is anything Are there any regular communications? And
Well, the Department of Public Health is responsible for almost the entire 30 townships. I think Stickney, Evanston, the three that aren't part of our Department of Public Health, that have their own public health departments. I don't know if it's Oak Park and Evanston and Stickney. That's what comes to mind. Forgive me for not knowing exactly. But we're responsible for the overwhelming majority of the townships. The Cook County Department of Public Health is.
got it.
And we work closely with the handful that aren't our responsibility, that have their own departments of public health.
Well, you know, one of your legacy actions was creating a economic development unit, which had never existed for Cook County, as far as I know. And you have staffed the Bureau with, you know, top flight professionals that have done just great work through the last, you know, decade, let's say, or just shy of a decade. So can you give us a sense of, you know, because one of the things that both the Alliance and CCAC is interested in, and touching on your point about how do we bring back the manufacturing, how do we support local businesses that may need to transition to be able to supply the PPE or the chemicals for our medications? Is that something that is actively being looked at, or something that you may be interested in working with us as we continue to look at that?
I'd be happy to work with you. It's not something I can say we're actively working on. I'm very proud of our Bureau of Economic Development. It's presently led by Sochi Flores, who's had a variety of positions in the administration, including a previous stint at the Bureau of Economic Development before she was part of our innovative team. So, you know, we'd be happy, and I'd be happy to connect Sochi to whoever you think is appropriate to talk about this. I spoke earlier about the importance of our country manufacturing its own personal protective equipment and components to our medicine, so that we're not reliant on foreign suppliers in an extraordinary time like this one. And I'd be happy to as I said, to work with you.
Thank you. That's excellent, because as you know, I mean, we are really, when we come out of this, it's going to be a very different world, and there is a lot of opportunity, and that's what we want to make sure that we're thinking now about setting the foundation for the recovery. Even if the recovery we may have some high hurdles before we get there, but now is this time to start planning and thinking about how we can help our economy, help our entrepreneurs, help our existing businesses, and really take advantage of being able to bring home those needs. We have another question, and it reads, do you have any plans for upcoming community outreach and informational events for doing business with the county, similar to how the city and DPS hosted their vendor fair?
Not to my knowledge, but I'll be happy to connect you, as I said, to Sochi Flores. I'll ask her to be in touch with you, Kelly, and to share with your membership what our Bureau of Economic Development is doing. I know that we've had a number of seminars around accessing the federal support, the Paycheck Protection Program money, the PPP money, and also webinars around accessing our small business grants to suburban small businesses and to independent contractors, gig workers. So I know that we've been doing a number of webinars, but I can't speak to this particular issue.
Okay, great. Well, we appreciate that that we can do this follow-up. As you know, we work closely with your team, and I am grateful for that. It looks like we are just coming upon the 1 p.m. Benchmark for us saying goodbye to the audience. So I do want to thank you for joining us today. I want to thank you for all the years that you have come and spoken to our group in person, that you are always so open to answering such a variety of questions, and for your commitment, you know, to Cook County. I mean, we are lucky to have such a strong, dedicated leader who has done so much, President Preckwinkle, and we are grateful for you.
Well, thank you very much, Kelly, for those kind words, and I'm grateful to have an opportunity to address your members. And through Kelly, we'll be happy to supply you with whatever information you need about what Cook County is doing, both to address the pandemic and our economic challenges.
Well, I hope that we look forward to, I hope you'll join us again, and we look forward.
Happy to.
checking in with you and seeing how we survive the rest of this year and into next year and work together for our recovery.
Thank you.
Thank you. And so to our members, thank you for joining us today. As a reminder, we always meet the second Tuesday of the month. This is exclusive to CCAC members, but as you know, we launched a webinar series. So on Tuesdays and Thursdays at 1:30, please make sure that you register. This Thursday, we're going to have the new leader of one region in Northwest Indiana. That is 5 counties working together. I know President Preckwinkle, you've been a great supporter of the Alliance and you really understand the need for regional economic development and the challenges with regional economic development. But the challenges only make us more inspired to make a difference. And we've got programming set up through September, so watch your emails, visit our new website, stay well, stay strong, and thank you for your support. Bye, President Preckwinkle. Goodbye, everybody. See you. Thank you.